Alrighty, my type 2s, we are starting with the basics today. This is, how do I check my blood sugar? I talk to pre-diabetics and type 2 diabetics all day long, every day. And I find more often than not, you guys are not checking your blood sugars regularly. How can you keep your blood sugar in control? How can you reverse prediabetes? How can you reverse type 2 diabetes if you don't know what your sugars are? That is the craziest guessing game. You can't wait 3 or 6 months to see your doctor to find out how your A1C is doing and expect to know that whatever you've been doing is working or not, right? That is just a crazy approach to health, and we're gonna stop that nonsense now. We're gonna stop that crap, and we're gonna start taking control and responsibility of our health, and we're gonna start looking at our blood sugars. So you need a glucose meter, whatever one you want. None are better than the other. They're all FDA approved. They're all going to be within 15 or 20% of a lab test. The Rely On meter from Walmart is the cheapest one on the market, cheapest test strips. Likely will also cost less than even your copay if you were getting one of the more expensive meters. I, as a type 1, use this as a backup for my Dexcom. I've never had an issue. So don't spend the money. Why spend more money than we as diabetics are already spending to keep control of our health? So get yourself a meter, test strips, finger poker, lancet, loaded with a lancet. Now these are one-time use. Got to tell you that. That's what everybody says. Not sure when I changed mine last. Clean hands. Clean hands is fine. Wash your hands, dry them with a paper towel or use an alcohol swab. Right? You got to make sure your hands are clean. Don't need any infections. Soap and water is going to be just fine. If you are not at a place with soap and water that you can wash your hands, you're out and about, you've got your meter in your car or your purse, have the little alcohol swabs, okay? Now, where do we poke our fingers? People don't know, which is why we're getting into the very basic step-by-step of how we do this. Don't go at your fingertip. Don't go at the pad of your finger. You have a sense called tactile sense, which is feel and is driven by nerve endings. So you sure as heck don't want to stick a needle in the place where you got all sorts of nerve endings to give you that sense of touch. You're going to take the side of your finger, so between your nail and between the pad of the finger. So right in there, about halfway through, is the best place to pick your finger. You will learn over time which fingers don't bother you. You'll end up with favorites. Be careful. Try and spread it around. You do end up with some callus formation. 30 years as a type 1, many years doing just this without the glucose meter, the continuous glucose meter, you do get some calluses, right? Gives you something to chew on in a boring meeting. So you're going to open up your alcohol swab, grab whichever finger you're going to use, wipe that down, let it dry. You are going to pull back on the lancet, put it up against the skin, and press the button, okay? It's that easy. Sometimes you don't get enough blood, sometimes you do. You might want to squeeze your finger a little to make sure you've got a good enough sample. Take your test strip. Do not put it in with blood in it. You put it in on its own, and then hold that up to the blood. I don't usually go right in it. I come from the side. The meter will pull in the amount of blood it needs. That will take 5 seconds, 10 seconds, depending on your meter. Wipe off your blood. If you have a dry Kleenex, that works. You don't want alcohol in a wound. It'll sting a little. But then, there, 5 seconds, it'll give you your reading. 73, that's probably a little on the low side. My Dexcom is currently not yelling at me. So chances are that I'm rising and it is not an issue. 73 is a little lower than I like, which is why I always have candy in my desk drawer. But that is the basics of how you test, and then grab everything and throw it away. Your finger will heal up. Don't go squeezing on it. I could probably still get blood out of it if I squeezed it again. You don't want to do that. But make sure you keep that area clean. Wash your hands after, wipe it down with the alcohol swab to know that we are clean, sanitized, not risking any infection. But that is basic Check Your Sugar 101. Now, like I said, these are one-time use, so make sure you have your lancets to reload. If you're going to reload, you take your cap off, you pull that lancet out, you push the next one in, and you break off the little safety cap. Put your cover back on, and you are locked and loaded and ready for the next time. Disposal. Most states, these can go right in the trash. If you've got a sharps container, that's probably the nice thing to do. If you're going to put them in the trash, I need my glasses for this, but you can go ahead and you can recap that, stick that right back in there so it's safe and nobody is going to risk a finger pick. And then you can toss those right in the trash. If you want, you can put them in one of the store-bought sharps containers, or just even load them up in something, a coffee mug, a coffee container, something, and you can seal that off. But in most states, check your local laws. It is fine to go ahead and dispose of those, if I can speak, in the trash. So there you go. If you have any questions on how to do this, follow right along. Reach out for questions. Christine at Dr. Christine Mags. I am always open for questions, right?